A 35-year-old male presents with right upper quadrant abdominal pain, nausea, and vomiting. On physical examination, he has tenderness in the right upper quadrant, and Murphy's sign is positive. Laboratory tests show elevated liver enzymes and a total bilirubin of 2.5 mg per deciliter. What is the most likely diagnosis? A. Acute cholecystitis. B. Acute pancreatitis. C. Acute appendicitis. D. Peptic ulcer disease. Answer. A. Acute cholecystitis. This patient's presentation with right upper quadrant pain, nausea, vomiting, and a positive Murphy's sign is indicative of acute cholecystitis, typically associated with gallstones obstructing the cystic duct. Elevated liver enzymes and bilirubin can occur due to inflammation and edema involving the gallbladder wall. Acute pancreatitis, choice B, would present with epigastric pain radiating to the back and elevated pancreatic enzymes. Acute appendicitis, choice C, involves the right lower quadrant, and peptic ulcer disease, choice D, would not cause a positive Murphy's sign. A 40-year-old female presents with a breast lump that is mobile and tender. Mammography reveals a well-defined, round mass. Fine needle aspiration, FNA, cytology shows foamy macrophages and multinucleated giant cells. What is the most likely diagnosis? A. Fibroadenoma. B. Breast abscess. C. Ductal carcinoma in situ, DCIS. D. Lipoma. Answer. Breast abscess. This patient's presentation with a tender, mobile breast lump, along with FNA findings of foamy macrophages and multinucleated giant cells, is consistent with a breast abscess. Breast abscesses often occur in the setting of lactational mastitis. Fibroadenoma, choice A, is usually painless and not associated with infection. DCIS, choice C, is unlikely to present as a tender, mobile lump, and a lipoma, choice D, would not typically cause breast tenderness. A 65-year-old male with a history of smoking presents with intermittent claudication and pain in his left calf that is relieved by rest. Physical examination reveals diminished pulses in the left lower extremity. Ankle brachial index, ABI, is 0.5 on the left and 1.0 on the right. What is the most likely diagnosis? A. Venous insufficiency. B. Popliteal artery aneurysm. C. Arterial embolism. D. Aortoiliac occlusive disease. Answer. Aortoiliac occlusive disease. The patient's symptoms of intermittent claudication, diminished pulses, and a low ABI on the left, compared to the right, are indicative of aortoiliac occlusive disease, often seen in patients with a history of smoking. Venous insufficiency, choice A, would typically present with swelling and a normal ABI. Popliteal artery aneurysm, choice B, can cause claudication but is less common than aortoiliac disease. Arterial embolism, choice C, would typically cause a sudden onset of symptoms, not intermittent claudication. A 28-year-old female presents with recurrent episodes of abdominal pain, diarrhea, and weight loss. A colonoscopy reveals aphthous ulcers and skip lesions in the terminal ileum. What is the most likely diagnosis? A. Crohn's disease. B. Ulcerative colitis. C. Diverticulitis. D. Ischemic colitis. Answer. A. Crohn's disease. This patient's presentation with recurrent abdominal pain, diarrhea, weight loss, and colonoscopic findings of aphthous ulcers and skip lesions is characteristic of Crohn's disease, which can affect any part of the gastrointestinal tract. Ulcerative colitis, choice B, typically involves continuous mucosal inflammation and is limited to the colon. Diverticulitis, choice C, typically presents with left lower quadrant pain and is more common in older individuals. Ischemic colitis, choice D, may cause abdominal pain and diarrhea but is often associated with risk factors such as advanced age and cardiovascular disease. A 40-year-old male presents with painless jaundice, weight loss, and pale stools. Laboratory tests show elevated serum bilirubin, alkaline phosphatase, and CA19-9. Imaging reveals a mass in the head of the pancreas. What is the most likely diagnosis? A. Chronic pancreatitis. B. Pancreatic adenocarcinoma. C. Pancreatic pseudocyst. D. Pancreatic neuroendocrine tumor. Answer. B. Pancreatic adenocarcinoma. This patient's presentation with painless jaundice, weight loss, and imaging findings of a mass in the head of the pancreas is highly suggestive of pancreatic adenocarcinoma. Elevated CA19-9 is often seen in pancreatic adenocarcinoma. Chronic pancreatitis, choice A, can cause abdominal pain, but it is less likely to present with painless jaundice. Pancreatic pseudocyst, choice C, are typically associated with a history of pancreatitis. Pancreatic neuroendocrine tumors, choice D, may cause symptoms but are less commonly associated with jaundice. A 35-year-old male with a history of alcohol abuse presents with acute onset of severe right upper quadrant abdominal pain, nausea, and vomiting. Physical examination reveals jaundice and a positive Murphy's sign. Laboratory tests show elevated serum bilirubin and liver enzymes. Imaging reveals gallstones in the common bile duct. What is the most appropriate management for this patient? A. Cholecystectomy. B. Endoscopic retrograde cholangiopancreatography, ERCP. C. Laparoscopic common bile duct exploration. D. Ursodeoxycholic acid. Answer. B. Endoscopic retrograde cholangiopancreatography, ERCP. This patient's presentation with jaundice, right upper quadrant pain, and gallstones in the common bile duct is indicative of cholelithiasis. The most appropriate initial management is ERCP to remove the stones and relieve the obstruction. Cholecystectomy, choice A, is typically performed after the resolution of the acute episode. Laparoscopic common bile duct exploration, choice C, is an option but is generally reserved for cases where ERCP is unsuccessful or not available. Ursodeoxycholic acid, choice D, is not the primary treatment for acute cholelithiasis. A 28-year-old female presents with a breast lump that is fixed, irregular, and non-tender. Mammography reveals microcalcifications and architectural distortion. Biopsy confirms invasive ductal carcinoma. What is the most appropriate next step in management? A. Lumpectomy with sentinel lymph node biopsy. B. Neoadjuvant chemotherapy. C. Mastectomy with axillary lymph node dissection. D. Hormonal therapy with tamoxifen. Answer. C. Mastectomy with axillary lymph node dissection. This patient's presentation with a fixed, irregular, and non-tender breast lump and findings suggestive of invasive ductal carcinoma on biopsy indicate a more aggressive form of breast cancer. The most appropriate next step is mastectomy with axillary lymph node dissection. Lumpectomy, choice A, with sentinel lymph node biopsy is a suitable option for smaller, localized tumors. Neoadjuvant chemotherapy, choice B, may be considered in some cases to shrink tumors before surgery. Hormonal therapy with tamoxifen, choice D, is typically used in hormone receptor-positive breast cancer. A 40-year-old female presents with a painful, red, swollen area on her right breast. She reports feeling unwell and having a fever. Physical examination reveals an erythematous, warm area with localized tenderness. What is the most appropriate initial management for this patient? A. Fine needle aspiration. B. Incision and drainage. C. Core needle biopsy. D. Mammography. Answer. B. Incision and drainage. This patient's presentation with a painful, red, swollen area on the breast is indicative of a breast abscess, likely related to an infection. The most appropriate initial management is incision and drainage. Fine needle aspiration, choice A, is typically used for the evaluation of breast masses but is not the primary treatment for an abscess. Core needle biopsy, choice C, and mammography, choice D, are not indicated in the acute management of a breast abscess. A 60-year-old male presents with gross hematuria and left-sided flank pain. Imaging reveals a 5 cm mass in the upper pole of the left kidney. Biopsy confirms renal cell carcinoma, clear cell type. What is the most appropriate next step in management? A. Radical nephrectomy. B. Partial nephrectomy. C. Systemic chemotherapy. D. Radiation therapy. Answer. B. Partial nephrectomy for localized renal cell carcinoma, especially in tumors less than 7 cm in size. The preferred treatment is partial nephrectomy, which involves removing the tumor while preserving the remaining kidney tissue. Radical nephrectomy, choice A, is considered for larger tumors or if there is involvement of surrounding structures. Systemic chemotherapy, choice C, is generally not effective for renal cell carcinoma. Radiation therapy, choice D, is not the primary treatment for localized renal cell carcinoma.